And hi guys, so today I have with me amazing guest Teresa Volner, all the way from Kansas. Teresa, so welcome to the community. Welcome. How are you today?
Awesome. Thank you so much for inviting me. I appreciate the invite.
Yeah. Oh my gosh, it's beautiful. We have a little pre-chat with Teresa, and for whatever reasons, I thought, Teresa, you are from Italy, but you are from Kansas. So yeah, we celebrate in
Yes.
Kansas. Yeah.
Woohoo! We're in Kansas City,
Kansas.
the home of the greatest barbecue in the world. You'll just have to come try it out.
Oh my, I didn't know that. I didn't know this. The greatest
Oh,
barbecue.
it's kind of fun around the United States. There are different locations for different styles of barbecue. In
Yeah.
Texas, they do more of a dry rub, but in Kansas
Yes.
City, it's more of a sweet, tangy sauce. And slow cooking, and it's just tender and amazing. Totally horrible for your blood sugar, but hey,
Once a
celebrate. You have to celebrate.
once in a while, maybe in the moderation once in a while.
Yes, 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 yes. All is good, little bits at a time.
Yeah, and Teresa, you do amazing work. We had a little pre-chat. Would you like to talk a little bit how do you help people who have blood sugar issues? Like, just a little bit to understand what is going on, what you see, and how do you help? Because you told me you reverse diabetes, right? Type 2 diabetes. It's reversible.
It is reversible, but that's a challenging title. And so most practitioners will tell you remission. But
Remission.
once you get diabetes into the remission state, then your body has a break. It's almost like you've taken the foot off the gas pedal and you may be rolling forward a little bit, but eventually the car stops. And then you can start to push it backwards a little bit and your body can begin to heal. It's almost like a wound that's been open for a long time and then it just begins to close up and heal. And next thing you know, you just have a little bit of skin there, right? And it's no longer a giant open wound. And
Yeah.
so this reversing process, which I've seen it happen. We just had a client call not too long ago, within the past month, and he's been working towards reversing his diabetes for 4 years. And he was one of the worst cases I've ever seen. Plus, he had asthma and allergies and liver disease and overweight. And he was a single man for many years, just not paying attention to health at all.
Mhm.
And so when he started to get his blood sugar in control, then knew what his body needed to fuel itself for healing processes, for healing the liver, for stopping the damage from occurring to begin with. 4 years later, he's calling me saying, Doc, I'm having such a problem because my blood sugar is dropping all the time. It's dropping. I said, well, what does dropping mean? What's the blood sugar when it's at its highest? He said, 125. I said, what is it at its lowest? And Rick said, it's 70, maybe. It might go maybe 68, but really 70. I said, do you realize that is a normal range? And his jaw dropped. He was in so much unbelief. I said, are you on insulin anymore? He goes, no, I haven't done that in a while. I said, are you on any other medications? He said, metformin at the highest dose. I said, you can start lowering that. Call your doctor, because as a chiropractor, legally, I cannot tell you what to do with your medications. But I'm like, call your doctor. You can start lowering your medications, your metformin, because for some people, metformin creates a lot of body pain. Statin drugs create a lot of body pain. There's a lot of things that people are using that just create a lot of pain and dysfunction.
Yeah. Yeah.
One of my clients in Ohio, I had to remember She's in Ohio. 80. She just had her 81st birthday. And
Wow.
we tend to think, oh, it's too late. I have been diabetic too long. I've never seen my blood sugar, my A1C under 7.0. And I said, you're going to now. And she would dread walking upstairs to her bedroom every night. She would be sitting on couch watching her shows, and she would dread walking up the stairs. And I said, if we get your blood sugar in control,
Mm,
her need for medication. So we already started lowering her need for insulin because she's been insulin dependent a long time.
mm,
Cut her night insulin in half, and she's lowering her need for insulin during the day. I said, well, what else are we taking that we can start addressing now? Now that we've started balancing some blood sugar and the habits, she can sleep through the night because it used to bottom out in the middle of the night. I said, the person prescribing you your insulin should have told you that you could stop taking so much insulin now, because that's too much insulin if it's continuing to drive your blood sugar down.
yeah.
But doctors don't have time anymore. And I'm a
Mm,
doctor of natural medicine, I've been a chiropractor over 20 years, which is very much naturally oriented. I said, the doctor doesn't have time for the day-to-day. The doctor doesn't have time for the coaching through, well, if this happens, do this. If that happens, do that. They just give you instructions and send you on your way.
yeah.
And so this woman was not able to sleep through the night for the last 10 years. I said, well, of course, your body regenerates through the night. And if you don't sleep, you can't heal. And within a month, she was able to sleep through the night. We did lower the insulin intake, and she eats 3 almonds before bed, just to make sure she carries her blood sugar through the night, because
Yeah.
protein gives you stable blood sugar. So even after having diabetes and insulin dependent diabetes for such a long time, we were able to make a change in this woman's life. So the next thing she did was stop statin drugs.
Wow.
Within the week of stopping the statin drug, because we can use alternatives to control cholesterol,
Mm,
within the week, she was able to walk up those stairs to her bedroom in no pain. She did not feel dread thinking about going upstairs. And so we developed a winner's method that we're addressing each person's individual issues and controlling blood sugar, lowering inflammation, lowering their need for medication, and creating a whole different life. You don't have to at 81 go, I've lived a good life. I don't really have to live more years. But my question is, do you want the years you have left to be quality years? It's not difficult, but sometimes you just don't know the steps that need to take place. And you might not know the best alternatives. So if you're on a lot of medications, maybe some herbs would interact with that. You would want to know which would work best for you without interfering with some of the other conditions you have. One of my other clients has damaged intestines from some other event. And she also has heart disease and a few other things. So we can't, and she has allergies. So we can't use every typical herb for balancing blood sugar. She couldn't use berberine. She's allergic to it. She couldn't use, other herbs that are just natural for getting these things in check. And she has to eat small plates because of the intestinal challenges, the digestion challenges. So one of the things we recommend then is enzymes to help break down your food So we're not dependent so much on how the intestines are acting to help break down food, that you can go straight into absorbing your nutrition.
Mm.
And if you can absorb your nutrition, then we can start to balance blood sugar, lower your need for medication. You know, it takes a whole history of what your life is like, what your lifestyle is like.
Yeah.
One of my other clients is a farmer, only eats organic foods, allergic to every medication. And we just tried everything alternative that she was allergic to half the herbs I normally use.
Mhm.
And finally, she had a non-healing wound, and I have hyperbaric oxygen in my office. I have Imstella for building strength for those who have been on Ozempic and other GLP-1 medications to lose weight, because you also lose muscle if you lose weight
Mm.
the wrong way.
Mm.
And I've got decompression. You know, I'm a chiropractor. I help people get rid of pain, build strength, and balance their life and have a higher quality of life. So we have hyperbaric oxygen, which is how I met her, through the other person. I don't know. I get a lot of referrals. But hyperbaric oxygen is super great for healing, and it's covered in the United States by insurance for non-healing wounds for diabetic. But can you get your doctor to prescribe it?
Mhm.
Access is so hard. Access, I mean, that's part of the challenge, is accessibility to things that really work for you. And that's covered by your Medicare.
Yeah.
So she's coming here, her children helped pay for it. We got the wound down to a very small, because it was pretty deep and it just wasn't healing. And so we tried all the alternative herbs and fiber and protein and other things that we could possibly try. And she just needed one more step. And it just took a while to discover that dandelion root, which is very healing and cleansing to the liver, dandelion was the last step that just pushed that wound into full healing. And now she does not have wounds, and she can live life farming with her boots on and not have pain. Yes, it's crazy.
It's such
But
amazing. Yeah. Amazing.
some of the most difficult cases, sometimes we have to do more testing as well to find out what are the missing pieces.
Yeah.
So in our office, we do lab testing, but my favorite two tests to do is the DNA test to find out what you've always needed your whole life.
Mm.
Because just because your great-grandparents, your parents, and just because everyone's been diabetic doesn't mean you have to express the genetics for diabetes. And there are different reasons in your DNA for that expression. Maybe your body doesn't detox very well, so you need some supplementation to help support it. If you can't see very well, if I wasn't wearing my glasses, right? And so these are supplements, right?
Yeah.
For your eyes. Contacts are supplements for your eyes. So if your DNA is missing the ability to detoxify well, my body is like that. I was born with the most horrendous liver function, right? Then you need to support that function in your body. And if it takes supplements, a particular tweak in your diet, then that's what we do. But DNA testing tells me what you've needed all along. And the second test I love to do, which is simple hair analysis. So I mail tests to you, and we mail them back to the lab. We get the results electronically. Zoom is so powerful. I'm so glad I get to visit with you today, being in Dublin. How amazing is that? We're going worldwide here. And we're connected. We're a worldwide community now, not just my backyard, right? And so the next test is a simple hair analysis that we measure IgG, food sensitivity, heavy metal toxicity. It also can tell me how your body is reacting with your digestive enzymes, if there are deficiencies that have been noted just in your body's function and excretion of minerals. I mean, we can see so much in just 10 strands of hair.
Wow.
I am astounded. And of course, it's the closest ones to your head, the most recent. And it tells me how your body has been bombarded by life and how your DNA has reacted to that life in the past 2 months. So those two tests give us a plethora of choices to narrow down, because inflammation, whether the inflammation is triggering the lack of good function in your body, or the lack of good function has triggered your blood sugar and imbalances and other imbalances,
Yeah.
we can even it out. You know, who came first, the chicken or the egg? Who cares? If we find solutions that work, who cares what came first, right?
Yeah.
We decode you. We personalize to you. And so one of my clients, green beans was on her list. She's
Uh-huh.
like, I grow green beans. What's wrong with green beans? I said, nothing for most people. But for some reason, your DNA, your genetics, your oxidative stress levels, it triggers something. And who knows what it is? If it's in the inside bean, if it's in the hull, if it's in something that was sprayed in the neighbor's yard that got on your beans when you're growing them, who knows what it is? I don't know. But if we leave green beans out of the diet for a couple of weeks, do you think you'll notice a difference? Sure enough, we noticed a difference. More blood sugar control, more quality of life, well into your 80s. What more can you ask for? Can you walk around the block today? Is it challenging? Do you feel the aches and pains? Just something simple like, I didn't drink enough water yesterday. I had aches and pains I didn't know existed, right? Dehydration, something just that simple. If
Yeah.
your body is prone to it through your DNA, we decode that, then we know you just cannot go on a complete fast,
Yeah.
right?
Yeah.
You have to drink water.
Yeah.
And it's just amazing some of the things that we find when we're doing the testing. And yes, there are some other tests we can do. Your doctor is always doing A1C test.
Mm.
A1C test tells us what your blood sugar has been fluctuating like
Mm.
over the past couple of months. But today, this year even, we now have access to continuous glucose monitors, totally pain-free. Just, I could see this explode, right? Because the average individual that's not even diabetic can see how their blood sugar fluctuates
Mm.
and manage other forms of inflammation in their body. It's available now, and we'll have a link to it in our website. And it's just amazing because in the next 10 days, I get my first shipment. We're going to just blow this away. I'm telling you, because then you can see hour by hour, day by day, how that blood sugar fluctuates. And if you match it up with your Aura ring or your iPhone health meter, I mean, the watch, because now you can get pulse and temperature and a bunch of other things just on a watch now.
Yeah.
They, years back, I read where someone was trying to research being able to do that with blood sugar, but they haven't yet. But now we've got CGMs, and every 2 weeks you put on a new one. It's painless. It's amazing, and affordable. It's very affordable and now accessible. So if you can't find one in your neighborhood, call me. I'll mail it to you. So, right?
Yeah,
It's accessible.
yeah,
So that's part of the challenges is we haven't had enough information, enough accessibility to the technology to do a good job because not one of us wants to be sick. Who wants to be diabetic? Who wants to be losing a leg or losing their vision or their capability to drive or live on their own? It's a big thing.
Oh my gosh, Dr. Teresa, this is amazing. And could you touch a little bit on your consultations? How do you work? Is it just the client comes, because I understood you do that on Zoom. So client comes, is it just one-off consultation, or is it really takes a bit of time and you maybe do a program or things like that to help? Yeah, if you could touch a little bit on that, please.
Okay, so the winner's method is what I'm focused on the most.
Mm-hmm.
And in the winner's method, what we do is meet for a free consult to see if it's even something that's going to be beneficial to you. But I have over 20 years experience. So if I know that if I can't help you, then I can find someone who can.
Yeah.
So there's that. So
Yes,
free
amazing.
consult is important to clear. Is this a good idea? Is this going to work for us? Are we good? Do you even like me, right? Do you have any, because that's hard. If you can't like and respect the person you're working with, that is so hard. So if that's not going to work, then we need to refer you to someone who you can work with. And that is important to note. I'm not meant to be everyone's helper, but
Yeah.
I do know a lot and have helped a lot of people. And even we take the time to teach people how to even use their computer so that they can get the classes online. So we have a full program that includes classwork, coaching weekly with a group, and one-on-one coaching, and the testing, and even counseling if it's deemed necessary. Because if there's a lot of grief, a lot of pain that we're covering with our habits,
Yeah.
then it's also important to address the emotional and mental capacity, the
Yeah.
states, because that's, I mean, even in our youth today, the suicide rate is horrendous. And anxiety and depression is overtaking people. And there's even coaching we have for that, but also counseling available.
Yeah.
And so that's important to note that we can start that process and then there's a fee for continuing it forward. But we try to, in a few visits there, uncover what the thought process is that's barring you from success. Are you afraid to lose weight because you've seen someone else lose weight, seem to look healthy, and then die? I mean, it's so impactful what we've seen in our lives.
Mm.
Are we settled into just believing that it's inevitable that if mom and dad were diabetic, that we're going to be diabetic? Are we thinking it's inevitable that we're going to lose our mind, our ability to process in dementia or Alzheimer's just because family members have been there?
Mm.
I know even my husband is walking through that dementia, early dementia right now. And I have researched and researched, and we have just tried different techniques. And we know what is working to help slow that process down, even if we can't fix the cause of the process. For him, it's blood flow. Matter of fact, at our 1 year anniversary, and this is another thing where decoding your DNA is so helpful. My husband is very healthy. He's 20 years older than me, and you'd never guess it because he's active, he's healthy. You'd never know. And on our 1st year anniversary, 8 years ago, he had a stroke. I know, astounding. You'd never know that this would ever happen. And he had zero cholesterol problems, zero blood sugar problems. I'm like, can I just check your health before we engaged in marriage? I want to make sure you're okay. You're going to live a long time for me. Uh, you don't just want to fall in love with someone and then, but you can't predict the future. Yeah. So he had a stroke, but he had none of the typical reasons for a stroke. And the doctor said, well, you need to be on statin drugs. Research shows that if you take a statin drug, you reduce your blah, 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 your next stroke, you'll prevent the next one. I said, do you even know why he had this one? He has zero calcium score. He has zero cholesterol buildup in his arteries. He has zero, nothing causing this. So if he takes a statin, which is, so his family history is, but mom and dad both had dementia. I said, if he takes a statin, it's one of the correlations to causing dementia. Do you think that's a good idea when he has no cholesterol problem? He has no calcium score problem. He has no hardening of the arteries. You are creating death for this man and you're shortening my life with him. So I told my husband, you are not taking those. I don't care what they tell you. Here's some fish oil. You are not taking those. And this was before I got into DNA testing. We did his DNA test, and number one on his list was vascular inflammation. His body has a tendency, when exposed to smoking, whatever, chemicals, food colorings, his vascular system, which in a normal person, you have over 100,000 miles of blood vessels. His blood vessels swelled closed, and then they relaxed and opened up again. So his little stroke that he had was strictly about blood vessels closing up, swelling shut, and then opening back up again. And he does from a previous injury. So then they did an MRI. We were able to see on his left occipital side a blood vessel that was damaged before. There was some scar tissue. It was a little tortuous in there. So we know that as long as he has enough antioxidants in his system, he has blood flow, he reduces his dementia, he hasn't had a stroke or anything related to a stroke since then. But we didn't know until we saw the DNA results.
Yeah.
Decoding your DNA, having better health, better future, better quality of life.
Yeah.
Yes.
That is so inspiring, Teresa. That is, I'm first time hearing this, from, so thank you so much for sharing that story. And guys, if you are listening right now and you would love to check your DNA or you want to do the hair analysis or both, as Teresa was saying, contact her. I already actually posted the links for Teresa's website where you can find her directly. And Teresa, just to clarify, you do work online, right? Via Zoom.
I work online. Now, shipping costs around the world, I have no idea how to measure that. So that could be challenging, but I do work online. Yes.
Yeah, amazing, amazing, guys. So yeah, so we have good news. We have Dr. Teresa that works online, 20 years experience, guys. This is amazing. This is huge. And as Teresa was saying, if she cannot, help you, well, she has big experience. She can refer you to someone else, just contact, get in touch. If you struggle with your blood sugar, if you're not sure what's going on with your DNA, my gosh, Teresa, this is such a beautiful conversation.
We've hit our time limit, haven't we? Because I can tell you one more story that's just so
Please,
crazy.
we still have like about 5 minutes or so. So let's do that story, please.
So I had sent out some marketing, and one of my old clients called me back. He lives here in this area because she needed to balance her blood sugar. So we
Yeah.
started that process, and all of a sudden she finds out she has cancer.
Oh, boy.
And it was just wild that both things happened at the same time, because guess what? If we balance blood sugar, we get rid of the tumor. And maybe the tumor for her was causing that added inflammation that triggered the blood sugar in the first place. So within a few months' time, both things were resolved. It's just crazy how your body reacts and how we can just create more health by balancing your system. Because those signals, they're just like a red light on your dashboard of your car.
Yeah.
If you put tape over it and you keep ignoring those signals, I'm having headaches or joint pain, or, my cholesterol's out of balance, which means your liver is a little out of balance, by the way. So if we listen to the signals and don't just put tape over this flashing light saying, check me out, check your engine, you
Yeah.
know, just in a few months, she was able to turn this around. It's amazing what we can do. Yes.
Oh my gosh, that is so amazing. As you said, like doctors, they just don't here the same, they don't have much time because the patient after you're lucky if you get like 5, 10 minutes. You're very lucky if you get, with your doctor. So it's really
Yes.
what can you do in 10 minutes? Very little, right? Yeah. So, and Teresa is absolutely amazing, with lots, as I said, lots of experience, and it's just so good, Teresa, I'm learning personally myself from you a lot from your story. I didn't know about your husband's that this can be a case. So to me, that's a new.
Oh, it's crazy. It's crazy, some of the things. And even myself, my own health journey, sometimes I say, Lord, do I have to have every problem in order to solve them all? But I've had my own blood sugar journey since 18 years of age, when I was having convulsions from hypoglycemia. And the only thing my doctor would say is, you need a counselor. You need to go see a psychologist because it's all in your head. It was not in my head. My blood sugar was dropping. I was having convulsive states, and it was not anxiety. And so between that, I've had cancer at age 23. I've had a bleeding disorder when I was 30. I mean, this is my 60th year, and I'm healthier now than I've ever been because I know what to do to keep myself balanced. And I can help you do that too. But yes, you kind of get tired of running into those moments where you have to take time out to heal. But you do. If you don't address the need for healing now, then you will be forced into it later, and the price will be greater. So prevention is easier than reversal. I will tell you that.
Wow. Teresa, thank you so, so much for sharing your beautiful story. And you look amazing it's just something I would never, ever, ever guess your age. And think,
Ah,
you know,
thank you.
you
I
should.
do have a few grays, but my husband is even challenged. He says, sometimes I don't even see your gray hair. I said, it's because my sulfur content is better. Gray hair is a deficiency. We don't have to get gray hair. Sometimes it's inherited, but
Yeah,
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 but some
yeah.
of that inheritance is a deficiency. So broccoli and cauliflower and Brussels sprouts all
Yeah.
will help you prevent gray hair. It's kind of interesting.
Oh my goodness, Teresa, you are
And
so
lower
interesting.
your stress.
Oh yeah,
Lower stress.
that
Get your sleep. Be healthy.
Teresa, it's privilege to have you in the community, guys. as I said, do get in touch with Teresa in the comments. All, you know, her name is here. She's on the Facebook. I'll tag her. So if you have any questions, please ask. Don't be shy. And the health, like my gosh, it's number one. It is like everything is possible with Teresa's approach. So Teresa, thank you so much.
You're welcome. This has been fun. I
Yeah.
love meeting new people. I would much rather do this, and that's one of the reasons I'm making a switch is it is much more fun to visit and to learn and to grow together than
Yeah.
it is to do paperwork. And
Yeah.
the insurance industry is becoming so burdensome, I will
I
tell you.
know. Yeah, it's in America. Yeah, here, yeah, in America, it's not covered, isn't it? Like natural medicine, it's not covered at all.
No, it is not covered, but it's worth every cent.
Yeah, it's so worth it. Oh my gosh, if someone, guys, can get to the roots to understand where this problem is coming, and not as Teresa was saying, tape it, but get to the roots. Like, yeah, why to hold it? Why, to live with these symptoms? Yeah, absolutely. Get in touch with my beautiful guest, Dr. Teresa. And Teresa, any final words that you would like to say to the community before we wrap it up?
The biggest thing you can do for your health is to love, because even if you research the blue zones in the world, some of that is lifestyle, but
Mm.
most of it is community. And get yourself into an environment that you feel loved and that you can share and love others. The Beatles said it once, all you need is love and
Yeah.
some broccoli.
I love it. All you need is love and the broccoli, guys. Teresa, that's been so much fun with you. I absolutely loved it. So, oh, thank you so much. Thank you
You're
so much.
welcome. You're
And guys,
welcome.
thank you so
Thanks for
much.
having me
Yeah,
very much.
absolutely pleasure. And thank you so much for teaching us all. You are treasure. It's so happy to have you here, Teresa, in this community. And guys, as I said, do get in touch with Teresa. Teresa, she's just amazing. So, okay, guys. So we'll see next time. And Teresa, if you could just stay for one sec.
Yeah.
Thank you so much, guys, for watching. Thank you.